The mission of advancing health has no expiration date, a time that we can say all goals have been met. On the contrary, the rapid and foundational changes healthcare is undergoing today will require the next generation of leaders in the field to be men and women of extraordinary vision, skill, and adaptability. Where will they come from? Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hetterly, Senior Writer at AHA. As today's healthcare leaders think about the eventual transition to a successor, what is being done to encourage and train the next generation of leaders to step up and meet the challenges of the future? In this edition of Advancing Health, you'll hear two highly qualified experts share their thoughts. Mary Jane Worth, Executive Vice President and Chief Operating Officer at the American Hospital Association, is speaking with Brian Granulotti, AHA's Chairman and President and CEO of Atlantic Health System. That's an integrated health delivery system that serves more than half of the state of New Jersey. Their discussion took place in late June at the Aspen Ideas Festival in Colorado.
Hello, and thanks for joining us. Few issues in healthcare are more critical than making sure we have the right people on deck, ready to lead our field into the future. But are we getting it done? The Aspen Ideas Health Festival is a great place to explore some ideas. With me today is my friend and colleague, Brian Granulotti. Brian is AHA's 2019 chairman and an experienced healthcare administrator. For more than 3 decades, Brian has overseen healthcare systems, large and small, in escalating leadership capacities, and I know he's passionate about this topic. Brian, thanks for being a part of this important discussion today.
Mary Jane, thank you for having me here, and I'm looking forward to our conversation.
You know, though it may seem far off for you, every responsible leader must plan for the day when he or she hands over the reins. So let me start there. Are we as a field paying enough attention right now to identifying and encouraging the next generation of capable healthcare leaders?
So the short answer to that question is no. And let me talk a little bit about why I think that's the case. You know, if you look at the data, there was a Stanford University study done in 2017 that found 46% of the respondents surveyed reported that they had no systematic process to identify and develop future leaders. My guess is that number is kind of low. So why is that the case? Well, it's difficult. It's hard work to do this. It can be emotional. Quite frankly, it's easier to avoid the work. But you got to face it. But it really starts with the board. You have to have governance that really understands the importance of this, and you have to have CEO commitment. But the other thing that often gets lost in these conversations is you really do need expert support and counsel. So I really think that as a field, we have a lot of work to do. You know, here at the American Hospital Association, that's part of our role, is to try to have those conversations with our members.
Yeah, as we're here at the Aspen Health Ideas Institute, we certainly are hearing the important role of leadership, certainly in all fields, but to progress in so many ways. I mean, what are the core competencies, the must-haves that tomorrow's leaders got to have?
You know, great leaders, there's a saying, great leaders are born, but they're also groomed. And great leaders need to also understand what they're doing in the organizations that they're working in and what their purpose is. So when I step back and look at what do we really need to do here, first is we need to have leaders who understand the business that we're in, not just today, but where we're heading tomorrow. And that isn't just the delivery of great health care and being able to work with a voluntary medical staff. It's a lot more than that. The fact that so much of what we're doing tomorrow is going to be that notion of how do we manage both the clinical care we provide, but also the financial care that we need to understand. because healthcare, as we know, is pretty complicated today, and it's going to get more complicated in the future. Consumers, who are our patients, are more engaged in different ways. And so when I look at attributes, they're in that category. So specifically, I look for people who have the ability to adjust rapidly and effectively in a disruptive environment. And what I mean by that are people who have courage and people who are willing to take risks. The second thing I look for are individuals who understand that this is a team sport and that partnerships are required. And so that willingness to build bridges with non-traditional partners, and that's where creativity comes in, and thinking and acting differently. And then the last piece that I really look for is understanding this migration from patients to consumers and making sure that we understand the implications of how that's requiring us to change the way we go about doing our business.
Well, that's a great lineup, Brian. I really appreciate you going through that, and certainly the courage that it takes and the creativity that is required as we go through the landscape of healthcare going forward. But not everybody, people who are courageous and creative may not necessarily be great leaders. What are some of the pitfalls that you watch out for as far as your ability to develop leaders?
Yeah. What I am always concerned about is when the work is about the individual and it's not about our communities and our patients. So I think, one of the pitfalls that I see is our folks that don't have peripheral vision. They don't seem to understand the environment around them. They may be the smartest in the class, they may be the most charismatic, but they don't have that peripheral vision, and that's critically important. Another pitfall that I see, particularly in healthcare organizations, is this notion of, you promote somebody to failure. And what I mean by that is we have sometimes incredible clinicians, and they're great clinical leaders, and then we put them into these administrative roles without any training, without any support, and without any true mentorship. And guess what happens? It works sometimes, but most of the time it doesn't. And then you end up with somebody that's frustrated, somebody that's maybe dispirited, and the organization suffers. The third thing that we really think through here is that the pipeline of leaders we have is not diverse, and it doesn't look like the communities we serve. And that becomes a problem because inherently we need to be more inclusive. And inclusion requires people who think and act differently. So if we all look the same, if we're all trained the same way, if we all act the same, again, we're going to fail. And then finally, when we ask leaders in the organization to identify their high performers, we don't necessarily have a rigor around that. And it becomes, well, I really like her. She's a good person. And we have to apply the rigor about, that's great, but how does she fit into a competency grid and an attribute analysis? So we have to apply more rigor.
Yeah, that's great, Brian, and really great advice as we think about not only the competencies but the pitfalls as well. And you were starting to go to, but it's not just the individual. They're working as part of a system and an organization. So, how are hospitals approaching developing leaders, succession planning, looking at their emerging leaders and promoting from within? What do you see happening not only in Atlantic but in hospitals around the country?
I think a lot of organizations are really struggling and trying to figure out a path forward here. But the good news is people are talking about it. And the good news is that we are staying focused on this. And a lot of the conversations I have with my colleagues are all around this piece. So let me tell you a little bit about what we do at the Atlantic Health System. We really break this into three pieces. The first is, how do we prepare our team members who want to be leaders? Because not everybody wants to do that. The second is, how do we support the people that are stepping forward, our newest leaders, to help them through their transition to management? Again, back to my prior comment, sometimes we put people into roles that they're not really set up or supported for, and they fail. And then the third is, how do we continue to develop existing leaders? I'm a product of executive coaching. I had a coach for 5 years. I really needed one. And because of that, it changed my life. And I really firmly believe that that's a responsibility that we have as an organization. And I can give you some concrete examples of the work that we're doing. The first is, we have an organized system of learning management, courses that are available to all of our team members, geared toward specific sets, and leadership training. We support our team members with tuition reimbursement. We've got relationships and partnerships with over 200 universities and colleges. We develop a career readiness program, and that's really important because we also are able to give folks college credit for that. And it helps them learn simple things like computer and communication skills, knowledge of medical technology, etc. We also have leadership development programs for existing managers and above in our organization. We've recently initiated a women's leadership program, and that includes mentoring within our organization, and I'm very proud of the work that we're doing in that regard. We've got a summer internship program where we introduce 20 or 30 students to healthcare and to our organization. And former AHA board chair, John Bluford, we work with his institute, and we bring great students in from diverse backgrounds. You know, I can go on and on. But the key thing is, you have to engage, you have to mentor, and you have to provide that support, and you have to meet people where they are, because life is complicated. When people are trying to do this, when they have families, when they have other obligations, they're working real hard, you've got to meet them where we are, and I think we do a great job with that.
Well, your dedication is very evident with the list of the activities that you do just within Atlantic itself. I mean, it's very impressive, the work that you're doing. But, you know, we are only as good as the people that we have working in healthcare, and they are our raw material, as I like to say, and therefore the investment to make sure that we're getting our best leaders today, but also for tomorrow, is absolutely essential. You know, Brian, our time is just about up here. Any just final closing comment that you want to make as we end this podcast?
You know, I always enjoy the time I get to spend with our young and emerging leaders. It's some of the favorite time that I have as part of my work that I do. And what I would encourage organizations to do is to engage on this activity. This has to be as much of a priority as making sure that we are providing outstanding care. It has to be as much of a priority as making sure that our financial performance are meeting our targets. It has to be as much of a priority as our growth initiatives, because without supporting our team members, we're not going to be able to care for our communities.
Well, I said that you were passionate about this topic at the beginning, and you certainly have shared your thoughts about how we help develop our leaders of the future. So thank you very much, Brian, for joining us today.
Thank you.
To sum it up, having the best people poised to lead healthcare into the future is too important to leave to chance. For AHA resources that help your organization, visit www.aha.org. This has been Advancing Health, a podcast brought to you by the American Hospital Association.